It was just a few years ago when news broke that a dental practice had to pay a $10,000 fine to the Office of Civil Rights, or OCR, for a HIPAA violation. The practice in question disclosed protected health information, or PHI, in response to a bad Yelp review that one of its patients left. Although on the more extreme end, that's a clear violation of the HIPAA Privacy Rule. Sharing PHI on a public forum is just one forbidden action of hundreds laid out within the Privacy Rule. But the HIPAA Privacy Rule is just one half, but the HIPAA Privacy Rule is only a third of the whole regulation. There's also the Security Rule and Breach Notification Rule, which are arguably more complex than the Privacy Rule. The point I'm trying to make with all this is that there are so many requirements to HIPAA that many dental organizations and their workforces end up confused. Now, any compliance expert would tell you that the breach that occurred to the dental practice who commented PHI on Yelp is the result of a poor training program. What they usually won't tell you is what you should include in your training program and how often you need to send it to your team as a dentist provider. Hi everyone, I'm Matt from eTactics, and today I'm going to give you everything you need to know about HIPAA training for dental offices. Before we get started, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. The first thing you need to know about HIPAA training for dental offices is whether or not HIPAA requirements are different in this particular field. The short answer is no. You see, HIPAA classifies organizations that deal with protected health information into two groups. You're either a covered entity or a business associate. If you're working at a dental office, you're considered a covered entity because you're a healthcare provider. If you wanted to get into the weeds though, federal law defines a dentist as a healthcare provider. In other words, yes, dental offices need to implement and take HIPAA training. The ADA, or American Dental Association, has an entire webpage devoted to HIPAA for dentists, and it strongly recommends that all dental providers implement HIPAA's required safeguards. The second thing you need to know about HIPAA training for dental offices is what content is included. You see, since HIPAA's requirements still affect dentists, the content of dental HIPAA training doesn't need to change. Since HIPAA defines organizations who need to follow its rules as covered entities, it makes classification easy, even for dentists. In other words, if a dental organization meets the criteria of a covered entity, then it needs to adhere to every requirement listed within the law. There aren't any differences between HIPAA for dentists and HIPAA for general practitioners. But just because HIPAA doesn't clarify dental offices any differently than other healthcare organizations doesn't mean that the content can't differ a little bit. That's why the third takeaway I have for you is that the HIPAA training for dental offices that you provide should include relevant examples in it throughout. Whether you're creating your own HIPAA training for dentists or sourcing one from a third party, the most important thing to keep in mind is the content. Do you think your team will learn effectively if their training goes over general examples about patient privacy? Sure. However, don't you think it would be much more effective if your HIPAA training contained actual real-world scenarios that occurred within the dentistry space? An excerpt from the book Mind, Brain, and Education: Neuroscience Implications for the Classroom states, "Often the learner's emotional reaction to the outcome of his efforts shapes his future behavior." That's why you need relevant examples to the dentistry space in your HIPAA training. Fourth, it's all about timing. HIPAA training is a requirement laid out as an administrative requirement within the Privacy Rule and as an administrative safeguard in the Security Rule. However, what the rules actually says are a little bit flexible. You see, the Privacy Rule requires that each new member of your workforce receives training within a reasonable period of time after the person joins. The Security Rule adds to the Privacy Rule's training requirement by stating that it should happen on a periodic basis. The ADA's website only reiterates all of these requirements too, so it's not much help. So what should you do? The best practice is to implement a training program that happens annually. The final takeaway I have for you is to ensure that the content stays up to date. In March of 2021, the HHS proposed roughly 15 changes to the HIPAA Privacy Rule. Most of these changes were to make certain parts of the law more flexible in order to account for the COVID-19 pandemic and the opioid pandemic. A few months later, in May 2021, the ADA made comments on some of the proposed changes, stating that they may overburden some dental offices. Now, including what those proposed changes were and the ADA's criticisms of them are two imperative topics to include in your HIPAA training program. Hopefully by the end of this video, you have a better idea of what's required of you and how to implement a HIPAA training program that's effective for your dental organization. Out of everything though, the biggest takeaway is that the requirements don't change across healthcare specialties. Regardless of whether you're a general practitioner or a specialty dentist, your HIPAA training mandates as a covered entity don't change. If you'd like to learn more about HIPAA training for dental offices, reach out to eTactics. And you already made this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.